Um, my name is Dr. Jemima Kariuki. I am the founder of Wills for Life and Calls for Life, an organization that is purely about women, pregnancy, motherhood, and just the infant child stage of life. And today I want to talk about something that we tend not to think about, and that's pregnancy losses. Um, and having gone through one myself um, some time ago, I I know and understand how painful and how life changing and how just it scars you to have lost a pregnancy. And that's what I'd like to demystify today. Um, One, what is a pregnancy loss or what's a miscarriage? And typically it just means the loss of a child or a pregnancy before 24 weeks or before the viable time. In Kenya, it's actually 28 weeks, although some institutions are able to bring a baby, a preterm baby, to the safety margin and on to childhood from as early as 24 weeks or from as low as 500 grams. But everywhere else, we consider it a miscarriage if it happens before 28 weeks. So we have early miscarriages or first trimester miscarriages and late miscarriages, or those that happen in the second trimester. And most of the time, there is no known cause as to why this has happened. In other words, there's nothing you could have done as a mom. There's nothing you could have done as a dad to make it different. We think as doctors that 60% of the causes are actually genetic. And I like drawing. One of these fine days, once I figure out how to draw, I will draw for you on video. But nonetheless, we have the male sperm and the female pronucleus or the female egg. So when they meet, they need to join and create the DNA to match precisely how the human DNA looks like. And as that happens, we have different variations in how they match. And that's how two siblings are different from one another because of the genetic translocations and all these things that happen to provide or to bring up a unique human that is you. But in some cases, as these translocations are happening, they end up having a mismatch or something genetic that cannot be is not compatible with life. Either it affects the breathing system, the brain, or the heart, just the vital systems of life. And because God is kind, and I'll say that with a lot of humility, because God is kind, He allows the pregnancy to just naturally select and not be able to go through. That said, it is painful. It's very painful. So there are 4 types of miscarriages in the first trimester that people discuss. We have the blighted ovum, where we can tell there was an egg and a sperm that met, but they seem to both carry no genetic material, and therefore they're empty shells. So you see a gestational sac, but you don't see the baby inside. There's a missed miscarriage, where the baby started growing, but for one reason or another just stopped. We have the incomplete pregnancy, incomplete miscarriages, where by the time you get into hospital, the process of coming out has already happened, and we are finding it on the verge of completion or in between, and whatever we need to do as doctors to complete the process is minimal. And then we have a complete miscarriage, where it's as if it was never there. Everything just clears off. And then we have those complicated ones, like the septic ones, where it gets infected for one reason or another. So what do you check for? You check for bleeding. Bleeding in the first or second trimester. Even the third trimester is not normal. And I'm talking about bleeding with clots. In the first trimester, it is possible to have a bit of spotting, especially if the area behind the placenta has a bit of a bleed. But that is a cause to go to hospital, to your doctor, so that they can check and give you the right medication to take you safely through. So bleeding, cramping, or heavy cramps. And if you are pregnant and then all of a sudden you don't have any of the pregnancy symptoms, the breasts are no longer full, or there's no nausea, there's no vomiting, there's like you just feel normal. It's a cause to just go do a scan and see that everything is going on well. What to do? Head to hospital. If it so happens that you start bleeding in any of these places or pain on one end and you don't understand, because that could be an ectopic, just head to hospital. If you don't have the transport, you're alone, you're stranded, you're scared, you can call us actually on 1196 and we will get you the help that you need. So what to do for you as a patient is just go to hospital and your doctor will advise accordingly. How do you treat it? It's dependent on so many things, and your doctor will guide based on one. We'll get there, we'll do preliminary test, a pregnancy test, an ultrasound, just to see how things are doing. And if we find that for sure there's a miscarriage, then depending on whether it's in the first or second trimester, then we give either tablets or we'll do a small procedure or a wash procedure. We call it a DNC or an MVA or suction evacuation, depending on where you're coming from, or what instruments you're using. So basically there's a small procedure that we do to just clear out, but it depends really on what we find at the time of presentation. But what I wanted to talk about is coping afterwards. One, don't blame yourself. There's nothing you could have done, or there's nothing you could have done different. It is important to go to the clinic early. It is important to follow what the doctors say, but it is also good to talk about the experience, talk to your confidant, and just get a way through it. It's important. You can take a sick leave as well. That's something that